Hello, this is Dr. Bob, Anthony, and Kason DeMaria once again with a half-off health program just for you. And tonight we have a very special guest, and she has quite a history. And if you know someone that's been on any kind of medication to lower their cholesterol, stay tuned. Okay, Janet,
Yes.
this is your moment in history. This is like Genesis chapter 10 verses 11 with Janet. That's good.
Very good.
Okay. Well, first, thank you for coming. It's not always easy. People are so busy today. And I know you come into the office and you're taking time out of your life because I asked you to do something else and you're going to another part of the country. And that's okay. So, talk to me a little bit about what made you come into office or what brought you into office.
Well, I was brought to your office by a friend who was coming and had come to a patient appreciation day. And I was so impressed with what I saw, and we were meeting Dr. Anthony and Dr. Kason for the first time. And I said, I'd like to know more about this. And I liked the fact that you were giving your fees for that day to a charity, a worthwhile charity. And I just felt that this was the place I needed to be.
I appreciate the fact that you mentioned that because sometimes, we put a lot of energy into events. And I know that Dr. Anthony and Dr. Kason did an awesome job that day, explained what we do in chiropractic. So what was the health ailment or the main condition that brought you in to see us?
I suppose I came because I was having problems with my back, but I was also having problems with taking medication. I was taking a statin drug. I had taken about 3 different statin drugs. Every time I would say, I can't take that drug, doctor, because it hurts my legs, I get cramps. And she would say, well, let's try another one. And I was on Zetia, I was on, I can't remember how many different ones. Finally, I said, I'm going to try natural.
It's kind of interesting. I'm kind of chuckling because this is what they were doing. This is the dice. Oh, let's give her this one. It didn't work. Right. We see that happen all the time, don't we, Dr. Kason?
So many people, I think now they're coming into our office because they want to get off their medications. So,
yes.
And all of the side effects we're learning too, how many minerals it depletes your body of and what they need to supplement forever if they're on these medications. So it's very common.
I know that we just had a consultation with someone the other day that he is living his health problem because of the side effects of those medications. So I'm going to make a really big point. She was on 3 different statins, and statin drugs have very serious bad effects, and one of them happens to be liver disease and joint pain. And the reason that it causes pain is it takes cholesterol out of your body that helps make natural cortisone. So then you made the wise choice to come to see us, and I'm sure that you had an awesome examination and films. Talk about that experience, because I'm sure that Dr. Kason and Anthony were part of that experience.
Well, let's see, what did we do? We did the blood, we went out and had the x-rays, and I had the blood work done, and I brought those statistics into you and showed them to you, and then I showed you the upgraded ones after I had been on the ABC diet for a while, and everything was just great.
We have to stop for a minute, because see, your cholesterol was high,
yes,
and it was not going down even with proven medication. That's sarcasm, by the way. And so then you decided you're going to do something God's way.
That's right.
It's very simple. So what was it that you did? Let's talk about what are these ABCs. You were a teacher too, by the way, weren't you?
Yes, I was.
And we want everybody to know that. At one time. Back before.
Back in the day.
Back before the internet.
Yes.
So what's the ABCs?
Well, it's half an apple, a red apple.
That's good. I was going to ask. We're going to clarify that.
A 1/3 cup of beets, and 5 or 6 baby carrots, taken all at the same time. I usually take the apple actually, some people blend them. I just eat them at the same time, and first I have my beets or carrots, and then at the end I eat the half apple.
Have you noticed since you were doing the ABCs that your bowels have been moving better by chance?
Yes.
We had to throw that out. I have to pull this out of you, literally pulling it out. Well, because see, did you used to have problems going to the bathroom?
Occasionally, but not often. But since then, I've been fine.
Okay, so for everybody that's watching us, Dr. Bob's ABCs is very simple. It's a half a red apple every day. Do you want to tell them why the red versus the green?
I've forgotten what you told
That's
me.
okay. I don't want to put you on the spot. Well, a green apple stagnates digestion.
Yes.
And a red apple promotes digestion. Okay, so how do you prepare your beets? Like, do you do anything special?
I either boil them and then cook them, or I bake them.
Okay.
And just about either way, that's how I do it. Put a little bit of Celtic sea
salt.
salt on them, and they're good.
Dr. Anthony, how do you do your beets?
I was baking them before. I've switched over back to doing raw beets.
Oh, you're eating.
I like raw beets on my salad.
We're going to a whole nother level now. I did that to you on purpose.
So I vary it because one of the things that we always talk about is varying how you cook your food. Sometimes you want to bake something, sometimes you want to eat it raw. The whole point of that is so that your body doesn't get used to how you're consuming your vegetables and as well as your foods. You don't always want to prepare something the same way because your body's always in a state of dynamic flux and you want it to be able to adapt to what you're doing. So I find that right now I'm on a raw beet kick.
Well, that's pretty good to know.
Well, carrots, I always eat them raw or cooked.
Yeah, I eat mine too. So you had some back pain and hip pain?
I did.
Talk to me about that. How long have you suffered with that?
Oh, I don't know, off and on for quite a while. Many years ago, I went to a chiropractor for back pain, and then I got over it. And just recently, I've been experiencing pain in my right lower back, but it's gotten much better since I've been having the adjustments.
So how do you like because we do some very special adjustments in our office. So talk to us a little bit about them. How do you like what we're doing to you?
Oh, I feel good after I've had this one. He's really does a number on me.
But she's petite but powerful.
She is too.
I know.
Yes, you all are. And I always feel much better after my adjustment. I come in twice a week. I come on Mondays and Thursdays. And usually by Monday, I'm really ready to come back again. So.
Your busy lifestyle.
Yes.
That's very interesting. So you had high cholesterol.
Yes.
So you're not taking any medication now.
Not for that.
That's pretty interesting because, people think that once they start taking cholesterol medication, and I want everybody to know, we don't take anybody off their medication. We didn't
No.
tell you to go off it.
No,
You
you
made that
didn't.
decision on your own. But isn't it awesome? Can you imagine how much money you're saving?
No.
How much are you saving anyway?
I don't know, but
We're going shopping with you.
Yeah, that's right. We're going to go to the grocery store and we're going to check how to grab your beets.
I'm spending it all on apples and beets and carrots now.
So what was your experience and what is your experience like in office? Because there's a lot of people nervous to come to see us. Can you believe that?
Well, I wasn't. I guess because of your reputation, I knew, of course, I had known who you were for a long time.
Have you watched us on TV before?
I had not.
haven't?
I have now. But
You're going to put it on Facebook that you are now?
I will. I promise.
Can I say that this is important because Janet is one of our Facebook followers and she keeps an eye on where I go.
That's right.
And she always makes comments. I do special sunsets just for her.
Thank you.
You're welcome. And so talk to us a little bit about, just your experience in the office.
I like the office. I like the fact that everybody is so friendly. I came in yesterday, not just the staff and not just the doctors. I was sitting by a gentleman yesterday who said they come up to every 2 weeks from Cincinnati because they found you on the internet.
I don't think that people realize that we have people that come to see us from everywhere. And you just got to come from, 10 minutes? Mm-hmm. These people,
yeah, 5 minutes across town.
I know. And so they've been friendly. People are friendly to you?
People are very friendly, and certainly the doctors are friendly, and your people at the front desk, and they always seem happy to see us, and I'm happy to see you guys. And
so there are going to be people watching that maybe have suffered for a long time, and they don't know where to go. And so I'd just like you to talk to the camera over there and just talk your heart to the people and just say, whatever is going on, whatever you feel comfortable with.
These people will treat you right. They're good Christian people. I know that, and I feel that they have integrity, and that they're going to tell you what you can do. And I'm very pleased with the results that I've had.
And it's kind of interesting because, you know, and I do appreciate all the niceties. Now, it was about a week or two ago, you and I sat in the back room, remember? Mm-hmm. And I beat you up, didn't I?
Yes.
Not not literally, but we had our own little come to Jesus meeting.
That's right.
And I'm just trying to be real with people.
Yes.
And just make a difference in their lives. I didn't beat you up too bad, did I?
Well, I'm coming back.
And so, how have you changed your diet?
Well, I'm trying to change my diet daily. I'm trying to eat more chicken and fish and turkey and green vegetables.
Very good.
And that's not always what I get done, but I'm actually trying to integrate that into my diet.
Have you started exercising?
I've been walking a little bit more than I did. I'm not actually started as much as I should, but I have been trying to walk daily and increase it a little bit daily.
Don't you have a garden?
No, I don't. My granddaughter's doing that now.
Okay, because I knew that
I do lawn mowing. I'm sorry.
Okay,
excuse me.
you do just even doing your own lawn mowing is a lot of work to do.
Yes.
So first, I know that you've changed your diet, which is really good, and your hip pain and your back pain went away. How long did you suffer with that before you came into our office?
Oh, probably a year, 2 years. Just it got increasingly worse because I guess it's arthritis. Who knows? But it's better.
So were you surprised that your pain went away so quickly?
Yes, yes, I was. Yes, I was surprised that it really. I can bend over and pick things up. I was telling one of my friends that yesterday I helped a woman who's probably half my age up off a chair, and then she couldn't bend over to pick up the things that she'd dropped on the floor, and I got down and got those for her, and I thought, hey, I'm doing pretty well here.
That's really, that's important because I think that people who are watching us right now, they suffer. They don't know where to go. Mm-hmm. And you know what I really dislike what the medical community does? They pretty much give you this label that you're never going to get better. Isn't it exciting to know that you're going to be better?
Yes.
And you know what's even better than that? We get to be with each other forever and ever and ever. We'll hang out and say, remember when I was on TV way back when?
That's when I'll have my new body.
That's right. Okay. Well, I'll tell you what. Wherever you're at, anywhere in the world right now, because we have people that come to see us from 2.5, it has to be a longer drive than that.
Guys from Cincinnati, my goodness.
That's 4 hours, by the way.
Yes.
So they make a day trip. You could be anywhere in the world right now. You could fly 4 hours. That means you could come from the West Coast to CLE. We're going to take a short break. Janet, you did such a great job. We'll be right back. Hello, this is Dr. Bob, Anthony, and Kason DeMaria with another Half Off Health for you today. And we have a very special guest, very special guest that's going to be with us tonight. And she's going to talk about some of her life experiences. So I have with me Chris. Chris happens to be Debbie's little sister. All right, thank you for coming today.
Thanks for inviting me.
So I know that she's made some huge lifestyle changes, and you've been a patient since how long?
I believe I was one of the original patients since 1978.
So if you do the math on that, if you're watching this, that's like well over 34 years. That's a long time. And I know that Chris comes in, actually, it's exciting. You've been really faithful at, besides your dad, who just turned 85 years old,
Yes.
You're my longest living tenured patients, besides, of course, your sister, that everybody in the family died, including, unfortunately, your mom and my mom and my dad. And I'm not saying we're the only, but everybody else has listened. That had to motivate you to maybe a little bit, didn't it?
Yes, it did. Yes, it did.
So talk about your experience in the office. We have Dr. Kason and Dr. Anthony. Dr. Anthony happens to be your nephew. So I'll let you guys chit-chat a little bit, and I'll take a break here and talk about life.
So tell me and Chris about what you've enjoyed about your experience at the office.
Well, chiropractic for me has really sustained my health as far as I don't seem to get the normal colds, flus, other ailments that seem to be seasonal.
That's good.
Where a lot of people are missing work, I rarely take a sick day. I probably can count in the last 30 years how many times I've missed work due to illness.
You know, that's kind of interesting because when we communicate, like you don't ever call up and say, just, oh man, I've been down for 2 weeks. And you said something that I thought was interesting too. You said normal. You know, like people think that being sick is normal.
Yeah.
And it's not even a part of it's not even on our radar screen.
So it's been really awesome having my aunt in the office, and we get to see her on a regular basis in the office. I know that she's been diligent into coming to some of the classes that we put on in the office called Half Hour to Health, where we go over relevant health topics. But I know that she has made some major lifestyle changes in the last year, and I'll let her tell you a little bit about that. But you know, it comes from a realization that sometimes you need to be self-aware of what's going on. So I know that you became to be self-aware from some pictures from our wedding.
Actually, not necessarily the pictures from the wedding. I still thought those were fine. It was going to see Dominic, my other nephew, your brother, in California in February. And when I got home and put the pictures up on Facebook to share with everyone, I was astonished that that was me. It basically said, who is that person? That possibly can't be me. So it was a sit down, and I actually had to come to Jesus talk with myself about what are you doing, and you have all these people who are trying to tell you what are the right things to do, and maybe by making a few small changes, I would be able to tackle my issues.
So I'm going to have you talk about some of those small changes, because a lot of people get really uptight about something that we're talking about with making lifestyle changes and losing weight. And a lot of times people are so concerned that when they start to lose weight, they feel like they need to go and lose 50 pounds the next week. And that's not the situation. If you make small changes over time, it's going to result in a big change. So if I was to say go lose 50 pounds next week, or let's focus on losing maybe 1 or 2 pounds a week for the next 50 weeks, those are small goals that add up to big goals over time. So why don't you tell us about some of those changes that you made?
Well, I actually started on March 12th was my start date, and by vacation in June, which was around Father's Day, I had lost 35 pounds.
And that's huge.
And it was really simple changes. No matter how much people don't want to hear it, it is diet and exercise. There's no magic pill, there's no magic formula. It is basically, I kept track of everything that I put in my mouth, and I made sure I was putting the right things in my mouth. And it was a conscious effort as far as looking at a cookie or looking at an apple or things like that. It really was very basic, very simple, and moving my body.
Were you surprised that you could lose 35 pounds
Yes. Yes, I will. Because I've tried before, and it was this time I was very conscious and very diligent that this was going to happen. And that was through June. In July, August, and so far in September, I haven't watched as serious as I had before, but I've been able to maintain. So to me, that's just as huge as the weight loss because I know I can do it. It's not creeping back on. It's by continuing the exercise, continuing watching what I'm eating, that the weight is staying off. But come October 1st, I'm ready to get back on and lose that last 20.
So I'm going to tell everybody that's out there and watching and paying attention to what we're doing with lifestyle changes and here with Aunt Chris. Her being my aunt really made an impact on my life, because when you see someone that's part of your family, all you want to do is be able to love them and work on giving them the right information for them to make changes. And I know that it comes to a point in someone's life where you need to have a conversation with them about what they're doing, and they might not want to listen about what's going on, but I have to congratulate Aunt Chris because she is one of those people that I would want to be around for a long time, and making those simple lifestyle changes now can save her so much time, energy, money, and effort later, that I think that she's beginning to realize that this could be one of the best things that she's ever done in her life. And, you know, like, it excites me because being young, I want you to be around for a long time. And, you know, with everything else that goes on in life, it's just exciting to have you here today.
Thank you.
You know, it's kind of interesting because you make chicken paprikash and, you know, like everybody think you could still lose weight and still.
It's very simple changes. There's a lot of recipes that I have made that are my grandmother's your great grandma's recipes that I have made small modifications to that have made them just as healthy as eating fresh vegetables. One that I can think of is our famous cabbage dish that we have for Christmas, and no one knows that there's no sugar in it, that there's no Crisco in it.
Hope he's watching.
Well, now you do. Surprise! but really, just making small modifications, knowing what is good as opposed to what is bad, or knowing what you can substitute to make it more healthy, is just the way I've been working on my recipes.
So I have to give kudos to what Dr. Anthony was saying, is the fact that if you did not, so I'm going to give you the bomb. If Chris did not change, I'm going to tell you right now what happened to her. She would have either got high blood pressure, she would have became a diabetic, or she would have had breast cancer. Because of what we see in our practice, that's what we see. And I think that, see, these are not Dr. Bob rules. Everybody thinks, oh, Dr. Bob said this, Dr. Bob said that. You want to know what? Water freezes at 32 degrees. Dr. Anthony could say it, Chris could say it, the TV cameramen could all say it. It's a rule. So what Chris said is, if you eat and you don't exercise, you are going to get fat. And the more you eat, the fatter you're going to get. And I know 60% of the people out there watching us right now. So, see, just because she's related to us, she still has to make the effort to come into our office. It takes time. It takes energy. So I'm going to let her give you the sales pitch. It's not really a sales pitch because Jesus had 12 disciples. Hey, go out there and tell everybody what's going on, and I'll come up and pick up the pieces. So talk to them. They need to see us. They're going to die.
Making a change to chiropractic is huge. And I still do go to a regular doctor once a year for physical.
Traditional medical doctor.
Traditional medical doctor. And she actually, you did say something. She had told me that you are pre-diabetic. You need to do something about it. So that was one of the other issues, as well as the picture about scaring me that it was time to do something. But I've been doing chiropractic since 1978, and none of the things that they were saying was new to me. It was just, finally, I was ready to make that step, to enforce it in my life stronger, and to make a difference. And if you want to do something natural for yourself,